everybody.
Just let me know when you'd like me to get started or when you think we have the right mix of people here to go ahead and
I think we have 6 board members. Ideally, we'd have a couple of more before we get 7, 8. Okay, we have 8. I think we can go ahead and get started.
wonderful. Thank you to everyone for being here today for the May Opioid Settlement Prevention, Treatment, and Recovery Board meeting. Um, we are excited to be making progress on our funding decisions, and as always, I'm really grateful to be doing this work for you. So, as you know, last month we decided to pursue an RFP process for the allocations that we are making this biennium. To help move that forward, the board asked OHA to come today with some approaches that we can consider as we think about what our RFP process will look like. Our objective today is to listen to OHA, hear their ideas and what they need to make any decisions that will get us closer to the goal of a workable RFP process. So our plan for today is to start with roll call, a quick review of our vision and call for conflict slides that before we head into our board business. The board business today will consist of a DOJ update, including some good news from the Purdue Pharma settlement, a fiscal update from Tammy, and some program highlights from Lisa. Then we will roll right into the OHA presentation on potential scenarios to help OHA develop a request for proposal implementation plan. We're devoting our entire meeting to this topic today, and we will have plenty of time for questions throughout the presentation and time for discussion. As always, we'll take some time at the end of the meeting to hear comments from the public. And then we will go over the next steps before we adjourn. So the first item of business today is our roll call.
Okay, let me know if you're here. I'll just call your name. April Roman. I just saw that they're coming in. Adria Decker.
I'm here.
John McElveen.
I am here.
Tammy Kane Suleiman.
Here.
Annalise Dolph.
Here.
Okay, Zeb can't make it today. Nicholas Ocone.
Here.
Lori Trieger.
Here.
Hi, April. I see your message. Skylar Brocker Knapp.
Here.
Joanne Linville.
Here.
Julia Hyduke.
Here.
Carrie Brajati. We know you're here. Rick Trelevin.
Here.
Fernando Pena.
I'm here.
Sheriff Matt Phillips.
Present.
Rep Hi Fam. Senator Lou Frederick. And Judge Celia Howes. Roll call is complete.
All right. So as a reminder of what the future that we are working to build looks like, I'm going to quickly read the vision statement that the board adopted in 2023. The Oregon State Opioid Settlement Prevention, Treatment, and Recovery Board are working towards a future which fewer people in Oregon use opioids to manage physical or mental pain or to create a sense of belonging, resulting in fewer people with opioid substance use disorder. This is possible because there is a robust statewide system of physician education and mental health supports for people of all ages. If people do suffer from opioid overdose, fewer die as a result because emergency responders and bystanders are equipped and educated to reverse overdoses. People who have opioid substance use disorder have unrestricted access to high quality community-based medical treatment options, regardless of how much money they make, whether they have health insurance, where they live, their race, their housing status, or their involvement in the criminal justice system. Care is coordinated and continuous when people move, whether it is from town to town or from criminal justice system back to the community. Once people's substance use disorder has been treated, they have access to long-term recovery support services, including counseling, supported family reunification, employment support, etc. The board will know it has been successful when measurably fewer people in Oregon are using opioids. Fewer of those who have used opioids are dying, or who use opioids are dying as a result. And those who are in recovery are able to live full, rich, and meaningful lives. And I just want to say, I reviewed this slide last night as I was preparing for the meeting, in addition to the board values and principles. And I really just feel like it's such a helpful grounding for the work that we're doing today. And I try really hard to think about the things that we will accomplish by the agenda that we have set out for our meeting today. And I feel really moved that every time I read this, that this is the work we're doing together. And what we're talking about today literally has the ability to impact every single one of these things and get us closer to that vision of success that we set out as a board. So I'm really looking forward to our conversation today. And before we get into that, we do need to talk about any conflicts that board members might have. I am going to note here that we're not going to be making decisions on any specific potential recipients today. We're talking about the approach that we're going to use when we work with OHA to design the RFP process, but I do want to give folks a chance to review this slide and share any conflicts they may have with the board. Well, I don't, it's hard to see what if people are moving to unmute when the slide is up, but I'm going to go with the fact that probably nobody does have a conflict today given the topic. So let's go ahead and transition to our board business. Our first item will be to turn it over to Adria for an update on settlement board happenings from DOJ's perspective.
Good morning, everyone. I apologize for my voice. I'm recovering from a cold. I may end up going off camera later, but bear with me because I have some great news today. All right, so first I'll start with the most exciting news from my perspective, which is that we have reached agreement in principle with the Albertsons Safeway company. Albertsons and Safeway combined actually dispersed the most opioids of any pharmacy chain in Oregon. So this is significant for us. The company has engaged in some pretty extended mediation with us. Oregon was on the mediation team, so I and my colleague Ian Van Lowe were intimately involved in setting this up with Albertsons. The national total, because it's a regional chain, that you might see in the press that the overall number of 755 million is a little bit lower than some of the other pharmacy chains. But because it represents a smaller collection of states and it's actually fairly significant. And on the level of Kroger for Oregon, Oregon will receive 38.2 million over 9 years. It's going to be front loaded for the first 2 years. I would not expect to see any money from this until next year, just because we've only reached an agreement in principle at this point. For the money, we are still hammering out injunctive relief, and then it will take a significant period of time to roll out, just like all the other settlements. It always takes longer than we think, but we're hoping that because we've done this many times at this point, we'll be a little bit more streamlined. We're still, like I said, we're still papering the terms for the injunctive relief, but we expect it to be much like prior settlements. And in fact, we're going off those as a model. Same Exhibit E requirements for spending, same rollout to subdivisions, and I'll be handling that again for Oregon DOJ. The next piece of good news is that Purdue Pharma was sentenced in federal court, criminally sentenced in federal court in New Jersey. And as a result, the Purdue Pharma Company has shut down. It is no longer, it is dissolved in bankruptcy. As of May 1st, all of their assets are now controlled by a nonprofit corporation called NOA Pharmaceuticals, KNOA. And as such, the bankruptcy payments and the settlement with the Sackler family can now progress. So we should be able to tell, we should be getting more information in the near future about payment timing and amounts so that we can incorporate those into our plan, the settlement board plans for the future. And then my third piece of news is the group of 8 settlements, which is the 8 kind of much smaller manufacturers that we have settled kind of collectively, is going forward. And it's probably the furthest along at this point because I have a complaint and judgments ready to file. As a reminder, that's collectively it's about $10 million for Oregon. And each company has a little bit different time period, but we will be adding those into our spreadsheet of expected payments. And hopefully by the fall, we should be seeing some money out of those, I think. I don't want to overpromise. So let's say by the winter. Uh, and I believe that's all I have for DOJ updates at this time. Does anyone have any questions? All right,
Yeah,
hearing
not seeing
none.
any.
All right. Thank you so much, Adria. Let's move on to our fiscal updates.
Good morning, everyone. Tammy Kelly, fiscal analyst here in the Oregon Health Authority Public Health Division Injury and Violence Prevention Program. Let's go ahead and walk through our fiscal update for this month. We've updated the slides and some spending that has happened with the funds. The first slide you're going to see is basically a summary of our payments received and allocations. We don't have any changes to this this month as of yet, but we have been notified of imminent deposit of 2 payments that are expected here in AY27, and working with Adria to be able to confirm when those are received. And we just haven't seen them quite yet, but we're expecting that imminently. So there aren't any changes with this one, with the exception of changing the allocation amount based on last month's meeting of the data system development. So that has been adjusted down to $1,025,555, reflecting the change that the board approved last month. And next slide. Thank you. So the next one is allocation expenditures. So we're continuing to see progress made in the expenditures for the different allocation buckets that the board has worked so hard to create and allocate. So specifically, again, I've changed the spending category for the data system development. You're going to see again that reflection of the $1,025,555 instead of that $4 million number. So this is current and up to date. So that changes the total amount of allocations that the board has done, and it moves that additional funding into available funding. So yeah, we've seen additional funds expended in recovery and in our prevention buckets, and I'm excited to see the progress as we move forward. And as you can see, we're now at 43% expensed. So exciting news there. Next slide. Next slide is basically a summary refresh on our allocations available in 2020 AY27. With this included data system allocation of $2.9 million that we've added as of last month, And so that brings the total funds available just for the revenue expected in this biennium to 13,542,332. So this is our most up-to-date data about what funds are available. Again, this doesn't include pending settlements that Adria talked about. And we're excited to be able to add those once we have payment schedules and confirmation of when those funds will be received. So again, AY27. And next slide. This outlines basically the expected revenue that we have left. So the two payments that I was referencing that are imminent are the Walgreens 4 payment and the Kroger payment 3. And so we're keeping an eye out on our fund reports to be able to report back when those funds are actually received. And these dates have always been estimated. So when the board is looking at these dates and the timeline that we're going to be presenting later, I'd like for you to keep that in mind because it's not an exact deposit date. We have to be a little flexible because these dates have shown to be just ranges and not an actual deposit date. So there's 11 payments that are still expected, again, with 2 imminent to come in, that would leave 9 remaining. But without those 2 that have been deposited yet, we have 25,500,000, a little over, remaining for deposit in this biennium through June of 2027. And that's it, what I have for fiscal. Are there any questions or clarifications that I can provide for the board? Oh, great. Well, you'll see me a little later. We have some more fiscal information about the RFGA timeline for funding and things like that that I'm looking forward to sharing. But for right now, I'm going to pass it, hand it back to Lisa for some program updates. Thank you, everyone.
Thank you, Tammy. So, Lisa Shields, I manage the public health side of the opioid settlement work, and I'd like to share a program update about our learning collaborative with you. So, as you know, typically the day after your monthly meetings, we host a local opioid settlement learning collaborative, and the planning team is ADPC, OHA, Comagine Health, and our wonderful representative from Clackamas County, April Heron. So for tomorrow, we will be acknowledging National Mental Health Awareness Month, as well as National Prevention Week. And as always, we'll have Adria provide the same updates that she just provided to you. And we're going to focus this time on Lincoln County. So Jennifer Beckner is going to come in and just talk about what Lincoln County is doing with their opioid settlement investments. And as always, the ADPC website has all of the Learning Collab information, including meeting recordings and materials such as the quarterly newsletter. So all are more than welcome to come to this meeting, and you can either let me know or follow this email address. So I'll pause there for any questions or comments about the Learning Collaborative. Okay, next slide, please. All right, so now I'm going to shift gears. So this we're about to delve into a lengthy presentation with myself, my colleagues Courtney and Michelle and Tammy. And then I also wanted to introduce you to a couple people who are also helping us today with in particular, the discussion portion. So Shannon, could you please introduce yourself?
Yeah, hi everyone. My name is Shannon O'Fallon, she, her pronouns. I'm with the Oregon Department of Justice and I'm in the General Counsel Division, so a separate division from Adria. And I am the attorney that if the board has legal questions and need legal advice, then it comes to me and I help them with that. Nice to meet everyone.
Thank you. Shannon has been with us every step of the way since the beginning, and we appreciate you so much. And Stephanie Morgan.
Yes, hi, good morning, everyone. My name is Stephanie Morgan. I use she, her pronouns, and I work for OHA, ODHS's Office of Contracts and Procurement. Thank you.
Thank you. And the reason we have legal counsel and contracts and procurement here today is to help answer any clarifying questions that you might have as you discuss this potential for a request for grant applications process. So the focus of this presentation is just to provide you for some information for discussion as we continue exploring what this process could look like if you choose to do so. And we were calling it an RFP, and the Office of Contracts and Procurement, OCMP, asked us to make sure we clarify that at OHA, this type of process is called an RFGA, but we can use them interchangeably in this presentation, but please know that it's kind of the same thing. So, okay, next slide, please. Okay, so as I mentioned, we're just going to go over some potential scenarios for you to consider. And we are requesting that if you would like to proceed with this idea, we do need some information to be decided today so that OHA can go home and develop an implementation plan to bring back to you. So we'll be reminding you twice of the kind of the two things we need to get this process started. Next slide, please. So what we'll be going over today is first some kind of level setting and background. Then the fabulous Tammy will go over the budget and payment timeline. And then we'll talk about some RFGA scenarios, and that will be divvied up between Michelle and Courtney. And this is just some potential ways that directions that this could go in. Please know that this isn't a comprehensive list. It's just really a starting conversation. And then we'll have lots and lots of time for clarifying questions and discussion. Next slide. Okay, so we sent out your packets last Wednesday, and I know, as always, these packets are dense. There's tons of stuff in them, but the purpose of this meeting's materials was really to show you what we're basing these recommendations on and also to help you focus your discussion. So there's a high-level summary of this presentation. We always have the materials ready before the slides, so knowing that the slides weren't quite final, I wanted to at least give you an overview. And then Courtney and team have worked really hard on updating an overdose disparities fact sheet. And I know we provided a lot of preliminary data to you last month, and we didn't really have time to go over it, but the overdose disparities fact sheet is based on the most recent overdose death data that we have. And we're hoping that that can help guide your discussion when you're considering impacted populations. And Michelle also did quite a bit of research into what the RFP process has looked like from other states conducting opioid settlement request for proposals opportunities. And we can always do a deeper dive into that at a future meeting and give you more information, but it's a really handy overview. She does have a slide that touches on it. And then another thing that Michelle researched was really looking at where do we know for sure there are gaps in the current SUD continuum, and that draws on several sources that are in your packet, such as the updated ADPC comprehensive plan, what we know from the Burn Network, the Behavioral Health Resource Network, and then things we know that are not reimbursable by insurance. So these are all potential strategies to focus on. And then the National Academy for State Health Policy, or NASHP, they do a lot of coordinating at the national level on what states are doing. They have a really good website that shows you what each state is up to and how the money is being spent. And they put out a toolkit for how we can better partner with community-based organizations and some guidance based on feedback and lessons learned. And Oregon is featured in that toolkit in a couple places. So we recommend if you ever have the time, please do check that out. So again, all of this material is to help you think about what direction you'd like to invest the funds in. Next slide, please. Okay, so what we're presenting to do today is just some information, potential funding models for you to discuss. It is not a full implementation plan or proposal. That will come next after we get this some of these points nailed down. Next slide, please. Okay, I'll hand it over to Tammy, who's going to walk you through what these payments look like as they come into the Treasury account, and then Tammy will be handing it over to Michelle.
Thank you so much, Lisa. Yeah, so the first slide that you're seeing here today, we had last month as well, but I wanted to be able to address it again and really try to outline just how the payments are spread out across the biennium. And as you'll see, there's two bars there at March 31st of 26. Those are the two payments that we're actually expecting imminently into our account. So I think that's a really good representation about just the flexibility of this timeline as we're waiting for funds to arrive. So I wanted to just outline this again and be able to demonstrate that we have payments that are going to be spread out throughout the entire biennium, which directly impacts the amount of money in the account and therefore the amount of money we can actually issue out in contracts or grants. It directly aligns with available funds. Next slide, please. This table that I set up for you was to try and visualize it in another way. So basically what I've done is provided the income coming in as available funds and then also our obligations that the board has already allocated for this biennium going out at agreed times based on the what the needs are for the program. So for example, the burn program, that allocation that the board made was really urgent. And so working with that program, we got dates of when we're going to be doing allocations for the Behavioral Health Resource Network. First one being in May. We're working on that right now. The next one of $8 million. The first one is $5 million. The next one will be $8 million in September of this year. So that directly also impacts the amount of funds available for contracting, grant writing, et cetera, and funds available to go out the door. So this table is really to visualize and represent what the balance is and when those funds would be available for an actual, large RFGA process where we could get many grants written and get funds out the door to these partners and community organizations. So as you can see at at the end of our biennium in June of 2027, that's when that full $13,542,000 that I referenced earlier, including the carryover from AY25 and all of the available revenue from AY27 would be available where you'd have that full pool of money. And this kind of gives a snapshot of how the balances go down as we take care of obligation for important things like Save Lives Oregon, our Behavioral Health Resource Network, and Tribal as well. Again, these numbers do not include the settlements that are pending, so that there will be additions to that. Once we have those numbers, I'll be updating all of the tables and information that we have and keep this updated as we move forward. So with that, I'm going to pass it to Zach so that he can facilitate any clarifying questions. Thank you.
Thank you, Tammy. Just wanted to take a moment to pause for clarifying questions. We're going to do this throughout the presentation. So if there are questions specifically about the fiscal items at this point, that'd be great. We're happy to answer your questions now. And again, there'll be multiple pauses throughout. So
Hey, Zach, sorry to interrupt. So I forgot Carrie was supposed to introduce my presentation and has all kinds of stuff, context to provide. So maybe after this, we could go to Carrie. And my apologies for not looking at the facilitation guide PRR that you thoughtfully put together.
I think we could just leave it, actually, Lisa. Sorry.
Oh, okay.
Yeah,
well, the
that's fine.
point was that the co-chairs helped us a lot with shaping the presentation and the direction to go in, and we appreciate it so much. Thank you.
Thank you for flagging that, Lisa. Are there clarifying questions from the group? April?
Yeah, thank you so much, Tammy, for putting this together. Sounds like it was a real group effort from everyone. In the plainest terms, what does this mean in terms of the money available for our timeline? So if we're talking about creating an RFGA, then when would we be able to, what's the soonest, I guess, that we could commit to the full 13 million plus that we have identified as available for this remaining fiscal year? Because if I'm looking at this, it looks like we don't have it sort of ebbs and flows through that time. So in terms of our decision making, could you help us understand that?
Sure. Thank you. So in the timeline, I think that we're going to be presenting later as well. The RFGA process itself takes time. And so that works in our favor as well, right? Because we want to frame it right and have the grant applications representing the work and the priorities that the board is going to be setting. So within that time frame, we're really looking at the RFGA process to be finished and the projects to start in July of 2027. Again, this will be addressed in the timeline slides that are coming in the future. And I do think that that aligns with the fiscal, the gathering of the funds, getting the funds in place to be able to do those awards. So I'm comfortable with that, looking at a July of 2027 award date, project start date where the monies can be available and provided to the community.
Thank you, Tammy. Are there other clarifying questions on the fiscal slides? All right, seeing and hearing none, I think we can continue on.
Good morning, everyone. Michelle Frizzell, Subsystem Coordinator. I get the pleasure of working with this board. Hopefully you all can hear me well. Next, we're going to walk through the steps involved in conducting a request for grant applications, or RFGA. We worked with our contracts office to confirm the required process. I won't walk through every line here since it's included in your packets, but I'll highlight the major components. Once we've received direction from this board, the first step is engaging key partners, including the board, to confirm objectives, priorities, and any required criteria. From there, we begin developing the RFGA schedule, the scoring rubric, and the evaluation materials. Selecting and testing an online grants management platform is also a very key and important step. We want to ensure that the application submission and reporting processes are smooth and accessible. During this period, we also begin recruiting and prepping the application review team for those that want to be included in the review team. Once all materials and systems are ready, we post the RFGA, offer informational webinars and open office hours, and then receive and evaluate applications using the established criteria. After the review, we issue a notice of intent to award. The final phase is working with successful applicants to develop agreements, budgets, and work plans. Next slide, please. Before we can begin all those RFGA steps, the board needs to make two important decisions. First, which RFGA framework or model you'd like OHA to use, and second, the funding amount you'd like to allocate to the process. Those two decisions are what will allow OHA to begin the implementation work. Next slide, please. Once we have those decisions from the board, OHA will develop an RFGA roadmap, essentially a full implementation plan. This plan will outline the timeline, who we will engage, and when, priorities, how priorities will be finalized, and all of the components of the application and review process. We will bring that plan back to the board, hopefully at the June meeting, to walk through it together, receive your feedback and approval before anything is launched. Next slide, please. This is a tentative timeline to give you a sense of how the RFGA process will unfold over time. May, this meeting, is when we're hoping the board will make the decisions on the RFGA approach and associated budget. June, next month, is when OHA will bring back a full implementation plan to the board, including all statutory requirements under House Bill 4098 for review, feedback, and approval. They'll be included, of course, and thought of while we're developing it. Summer of 2026 will focus on partner engagement and development of the RFGA materials. The RFGA would launch in fall of 2026, and winter of 26-27 will be the application review and grantee selection period. Spring and summer of 2027 will focus on developing agreements, budgets, work plans with the awardees, and projects would begin in summer or fall of 2027, depending on readiness. And the next slide is going to be for questions, and I'm going to go ahead and pass that to Jenny.
Yeah, any questions that folks have for Michelle on the timeline and how we get there? You'll have other opportunities during the presentation as well. Oh, Annalise.
If I can just make a quick, oh, sorry, I froze there. If I can just make a quick comment, a quick reminder, I think this is clear, but I'm getting some direct messages about it that just a reminder for folks that we are talking about just this one-time funding. We had this conversation and we've talked many times that after this, we're going to come back together and talk about longer term and what our plan is for longer term. I think that's clear. I just want to remind folks of that as we go into this.
Any responses to that or other questions or comments? Getting some thumbs up. All right. Okay, hearing none. Yeah, let's move along.
Okay, next, there we go. So in April, the board identified several goals to guide the RFGA process. The board highlighted the following: increasing access to funding for organizations that have not traditionally received state dollars, encouraging innovative, community-driven solutions, ensuring a clear and transparent application process that minimizes administrative burden on organizations, supporting services that face federal funding limitations, and ensuring funding reaches all parts of the service continuum, considering different tiers of grant sizes to accommodate organizations with varying capacities. Next slide, please. As we move on into this section, let's revisit the goals in April, which we just did. But alongside the board goals, we are also going to align things with the guidance, including the ADPC Comprehensive Plan, House Bill 4098 that includes Exhibit E, equity considerations for underserved populations, ongoing evaluation of funding effectiveness, evidence-based and evidence-informed strategies, public input, and the terms of the settlement agreements. All of these requirements will be built directly into the RFGA. Next slide, thank you. So when I was looking at all of the RFP models across, like from the different opioid settlement boards, I of course could not fit them all on one slide. So I just included the most common approaches that other states have used, which are these. I'm not going to go over all of this. We have a lot of content to cover, but this is included in your packet. And which is state-led models, mixed state and local governance. And I went ahead and included the states down there. This is in your packet though. So next slide, please. And with that, I'm going to hand it over to Courtney to walk through the potential approaches that the board can consider. Thanks, Courtney. Go ahead and take it away.
Thank you, Michelle. Good morning, everybody. Courtney Fulton. I use she, her pronouns. I'm with Oregon Health Authority. I serve as the Overdose Prevention Program Manager in the Injury and Violence Prevention Program. And so I'm going to dive into the potential RFGA approaches for the board to consider. As Lisa mentioned, this is not comprehensive, but just to get away to start thinking about different approaches that the board may want to use. We did base these proposed approaches around what the board has already stated as their priorities, as well as what we've heard from our partners as their priorities, and also just what has worked well in the past with this program and other programs at OHA. Next slide, please. So the first approach for the board to consider is a population-specific approach. And what that would mean is that the board identifies priority populations and then funds organizations to implement like culturally tailored interventions across the continuum that meet the unique needs of those specific populations. Next slide, please. So as Lisa noted earlier, we did include a fact sheet highlighting overdose disparities from the most recent data that we have available. So this is just an overview of what we would consider to be either high risk or underserved populations that are experiencing the biggest disparities in Oregon. And so if we were if the board was going to choose a population specific approach, these would be populations for the board to consider targeting and prioritizing with that funding, which could include American Indian, Alaska Native communities or Black and African American communities who we know experience the highest overdose disparities in terms of death rates. It could also target specific age groups, for example, seniors 65 years and older, who we now know are experiencing increased overdose deaths compared to decreases across other age groups, all other age groups in Oregon. A population-specific approach could also be used to target funding towards specific regions that have either higher overdose death counts or death rates within their regions. And then other populations that we know are at higher risk of overdose in Oregon include males, people experiencing houselessness, people recently released from jail or prison, and people with a history of substance use or overdose. And so this approach could target any of those populations. Next slide, please. So just a scenario of what this could potentially look like is that the board would agree to implement a population-specific approach and then identify the one or more priority populations that they wanted to target with funding and allocate a specific funding amount for each of those priority populations. And so OHA would then design an RFGA, and organizations that either serve or represent those priority populations could apply for funding specific to those populations to implement different projects and activities and interventions that specifically serve that population. Next slide, please. So some benefits of this approach is that it prioritizes the communities that are most impacted by substance use and overdose in Oregon and prioritizes them in a way that interventions can be designed to be community driven and meet those communities' unique needs. This could also enable a cross-continuum approach. And when I say that, this is really based on feedback that we've heard from our focus grantees who are conducting culturally specific primary prevention work where organizations that are really in the community and engaging specific populations, there's a lot of opportunities to do more than just primary prevention. And so this approach could allow for primary prevention and harm reduction kind of together to be able to work across the continuum for that specific community. Another benefit of this approach is that funding could be available to many different types of organizations. I've already mentioned community-based organizations, CBOs. This could also be available to local public health authorities, health system partners. It could be open to different types of agencies and organizations through this approach. Some cons of this approach is that by prioritizing specific communities, that does inherently exclude other populations from being targeted with this type of funding. So that's an important thing to call out with this approach. This approach could also be, it could be challenging to ensure statewide coverage with this approach. And also when you're allowing for different types of activities across the continuum, that would mean that it would be challenging to ensure equal funding distribution across the continuum. We've heard that the board has really appreciated being able to fund prevention, harm reduction, treatment, and recovery kind of equally across the board. Using this approach would make it more challenging to ensure that equal distribution. Another con with this approach is that it could limit pathways for current grantees to apply for continued funding to either have sustainability funding or to enhance or expand their existing opioid settlement related projects, because a lot of those projects don't inherently target a specific priority population as what we're proposing here. Next slide, please. So the board has already allocated population-specific grants, and so this is just an example of how you have done that in the past. And so the tribal set-aside, I think, is a great example of a population-specific approach. We've also had population-specific approaches within the primary prevention and recovery allocations, primary prevention through the regional health equity coalitions, and then, of course, the focus grants. And then in recovery through the culturally specific expansions in the recovery community centers. Next slide. So that was population specific. And now the next approach that the board could consider is a strategy specific approach. And what this would look like is instead of targeting specific populations and identifying those and targeting them, it would be identifying specific strategies and funding organizations to implement projects that align with the priority interventions to help fill gaps in services or infrastructure in Oregon. Next slide. So a scenario of what this could look like would be kind of very similar to what the board did with the last biennium, is allocating a funding amount per SUD continuum bucket or category. So a certain amount of money towards prevention, harm reduction, treatment, and recovery, and then identifying key strategies or priority interventions within each of those kind of buckets or categories. So organizations could apply for, say, treatment funding, and the organizations that are applying for projects that align with those key strategies would then be prioritized for funding. Next slide. So I know that this is like a big discussion, right? And we've been kind of the board has been going around on it in the past on how does the board identify potential ways for determining what those priority strategies are. And so there's several different frameworks that you could choose to use as a way to determine how you would identify your key strategies. This is an overview. I'm going to turn it over to Michelle to talk through each of these different possibilities. Michelle?
Thank you, Courtney. An option is to look at underfunded strategies in the areas where evidence-based strategies have been identified, but no dedicated funding source exists. Another source is the service gaps identified in the behavioral health resource networks, including gaps in harm reduction, recovery support, youth services, and linkages with the justice system. This right here is a high-level summary of the ADPC's 2026-2030 comprehensive plan, which outlines priority strategies to strengthen Oregon's response to substance use disorder. I spent some time on their website. They're doing fantastic work. I must just say that. But recommendations include expanding workforce, including telehealth, peer support, recovery housing, strengthening deflection programs, particularly those linking individuals from jails or emergency departments to services, implementing shared care planning and coordination across systems, supporting youth recovery schools and youth specific treatment options, and investing in community-led development to ensure services are culturally responsive and regionally grounded. These recommendations aim to reduce barriers, address disparities, and improve outcomes across prevention, health, and safety interventions, treatment, and recovery. Next slide, please. So this was burn service gaps, and I used I looked at the Secretary of State audits that were conducted in 2023, and just what the burns are not really funding, or there's lots of gaps across the state. Gaps in harm reduction services, such as syringe service programs, and consistent with access to naloxone. gaps in justice system linkages, including warm handoffs between custody settings, jails, and treatment providers, recovery supports, including recovery housing, employment supports, and accessible spaces such as standalone recovery community centers that are not tied to a treatment center. And workforce shortages across really the whole continuum, but really especially notable in frontier and rural regions. And limited youth-specific services across prevention, early intervention, and recovery. Next slide, please. Okay, so services not reimbursable by insurance, whether it's Medicaid, commercial plans, or coordinated care models, covers a defined set of clinical services. However, many activities that support the broader substance use disorder continuum are not reimbursable. For example, capital and operational costs for recovery centers or peer-run spaces are not billable. These facilities require funding for construction, renovation, maintenance, and staffing, all of which fall outside clinical reimbursement models. Similarly, many housing-related supports are not reimbursable, including rental assistance, capital for housing development or renovation, and landlord engagement activities. Some systems use landlord incentive and risk mitigation funds to expand access. These funds may offer protections to property owners, such as reimbursement for damages beyond normal wear and tear, coverage for periods of unpaid rent, or just small incentive payments to landlords who rent to individuals who may otherwise face barriers. There are also gaps in funding for youth recovery infrastructure, such as recovery schools, youth dedicated spaces, and youth-specific peer support. Workforce development activities, including training, supervision, incentive programs for peers and other non-clinical staff, are also typically not reimbursable. And justice deflection programs, as well as jail, emergency department-based linkages, do not fall under clinical billing models. While many of the clinical services are reimbursable, like assessment, outpatient, residential detox, peer support, and care coordination, in certain settings, they can be billed to insurance. The infrastructure, capital, operational activities, and non-clinical support surrounding them generally are not reimbursable. This is where flexible funding sources often can play a critical role. And next slide. And this is right back to Courtney, I believe.
Thanks, Michelle. And yeah, just as a reminder, so if the board decides to implement a strategy-specific approach, what Michelle just reviewed is different ways that the board could decide specific strategies to prioritize. I know that that was a lot of information, but just to kind of get you thinking on your options with that strategy-specific approach. So some benefits of this approach is that it would ensure continued investments across the substance use disorder continuum, as we've previously discussed. It would also enable the board to prioritize specific priority interventions based on any of the frameworks that Michelle provided or additional ones. And then this approach would also provide a pathway for current opioid settlement grantees to apply for continued funding. Some cons of this approach is that it does kind of continue that siloing of interventions within the continuum. And so going back to that original example, if the board continued to use a strategy-specific approach, primary prevention grantees would not be implementing harm reduction activities, for example. And that siloing has the potential to limit the innovative ideas that span across the continuum. We've heard that the board is interested in innovation, and so just acknowledging that this approach may limit that innovation. And then again, it would be challenging to ensure statewide coverage through this approach. Next slide, please. And so, again, some examples of strategy-specific allocations that the board has already made is allocations to the clearinghouse, and then specific allocations across prevention, treatment, and recovery, and then research and evaluation, funding buckets. So the opioid treatment program expansions and the ADPEP program expansions are really good examples of those strategy-specific grants that the board has already allocated. Next slide. And then finally, the last option for you all to consider is a hybrid approach, which would include implementing a combination of funding models. And this is what's most closely in alignment with what you all have done in the past, in the previous biennium. Next slide. And so an example of a hybrid approach, as you would guess, it includes components of the population and strategy-specific approaches, in addition to the potential for set-asides. And so in this scenario, there would be set-asides for capacity building grants, which we've heard you all indicate that you're interested in potentially making investments in those smaller organizations to build capacity for this kind of work, as well as a set-aside for continued programming for existing grantees. So you could do one or more or other set-asides, and then kind of come back and then determine if you want to do a population-specific approach for one or more populations. And so the scenario we've provided is, for example, setting or doing a RFGA for $2.5 million for projects that are focused on Black and African American communities. And then from there, you could look at your remaining funds and do a strategy-specific RFGA with what remains. In this example, that would be $2 million each for primary prevention, harm reduction, treatment, and recovery initiatives. Next slide, please. So some benefits of this approach is that it does ensure funding across different priorities. And so going back to that example I just shared, capacity building, grantee sustainability, priority populations, and then also equal distribution across the substance use disorder continuum. However, when you the more priorities and the more like populations that you determine, that kind of spreads things more thinly and limits the amount of available funding within each of those categories. This hybrid approach would also potentially create a longer and more complex RFGA process. And so, based on what approach you decide to use and what you decide to prioritize, the timeline that we shared with you earlier in this meeting may not be accurate for a more complex hybrid funding approach. Next slide, please. And I think with that, I turn it back to PRR.
Okay, I think this is Lisa. Lisa, you have the next 3 slides, and then we're back to clarifying questions.
Perfect. Okay, and then we also put together just a few other things for you to consider in your discussion. So let's bring up the next slide, please. So something to consider is, I know that this was brought up in April, and so we wanted to gauge your appetite for potentially different grant tiers. So the idea is to both build on existing infrastructure, but also to fund new innovative strategies. So potentially this could look like a pathway for current grantees to extend their projects. Some of these projects have real momentum and they're filling a serious gap. And a couple things that come to mind are, for example, the jail-based MOUD and technical assistance. Also, a lot of these culturally specific CBOs have been able to stand themselves up as independent organizations and hire staff. So things to think about. A lot of these, especially I'm thinking about the focus grants, went to organizations that hadn't previously worked in the substance use space. So, you know, it'd be interesting to extend a pathway to continue these projects. obviously a pathway for new grants, and then a potential set aside to help smaller or less resourced organizations build some capacity. And one of the reasons to consider this is that often CBOs are funded to provide direct services, and that's it. So they usually have, I'm thinking of, for example, federal grants. Often they have caps on how much can be spent on staffing, building administrative capacity, and other grant management tasks. So something that our evaluators, Comagine, are looking at is how did this funding make a difference at the organizational level? So one of the big differences is that, for example, ADPEP programs and CBOs and regional health equity coalitions were able to fund staff time to apply for other funding sources, for example. Next slide, please. Okay, so a few of you have a couple times raised the idea of what if OHA could contract with a third party, an intermediary organization to administer grants. And this is definitely considered a best practice by the NASHP toolkit and others, and there are a lot of pros to it, such as uh, we all know that a smaller organization can provide more administrative flexibility, faster. They can potentially award grants through mechanisms other than contracts, which is lower burden for recipients. They can be more flexible with payments and reporting. They can be chosen with an eye on whether they're tied to specific communities. They can be familiar and trusted messengers in communities. They can also reach organizations that might not hear about opportunities if it was just OHA managing this. Perhaps grantees would feel more comfortable sharing barriers or issues with a smaller specific organization. And it also shares power. It can empower communities to define their own needs and measures of success. And so some CBOs might be reluctant to engage with OHA because of the perceived or real administrative burden or power dynamics. Unfortunately, there are some pretty major cons. So lots of positives, but one of the cons is that this would have to definitely go through DOJ review. This work could be considered duplicative because OHA already ch charges up to 5% for administrative costs to do this work. And so there would be an additional administrative fee. So that would have to be checked out. And then we did ask Shannon for just some preliminary information. This is not an official legal opinion because DOJ doesn't have all the information they would need, but DOJ has given advice to other programs at OHA who wanted to do something similar.
Hey,
And
Lisa, I'm
yeah,
sorry. Can I just stop you right now? I just
sure.
want to make sure, right, that we're not waiving any attorney-client privilege here. So if we could
Oh,
just,
okay.
yeah,
Is this too much
maybe
information?
it's a little bit too much information. I mean, it's out there already, but if we could not sort of talk further about advice that
Okay.
DOJ's given, that would be great.
My bad. I'm sorry, Shannon. Okay, so just to let you know that it could be really complicated and possibly not allowed, but we would have to look into it with an official consult. So, okay. Another con to contracting with a third party is uh, sometimes by contracting with OHA, an organization, this is their way to get their foot in the door with our system and make them eligible for future funding opportunities. And then nonprofits might have higher staff turnover than state government, so this could affect continuity of relationships. So, in a nutshell, there are lots of good reasons to do it, but we're not sure if we're able to do it. So, next slide, please. Okay, and then we know that one of the sticking points for the first round of board funding was the time needed when capital improvements are allowed. And something for the board to consider is that capital purchases such as buildings and renovations and vehicles typically don't have any other funding sources, even though these are very necessary to run programs. And so that's something to consider. Also, I know that we've had so much back and forth about how long it takes to open up a satellite opioid treatment program. And even though it does take a while to get one up and running, please consider that they are self-sustaining once they're up and running because they are billable services. And then something else that we have found that you will see in our first evaluation report at the end of June is that these new recovery centers have become really hugely important hubs in communities that didn't have anything like that. And as a matter of fact, two of these new recovery centers that come to mind are in Josephine and Klamath counties, and they've extended their scope of work way beyond the original intent because this type of space in a community there's such a huge gap for this type of work. Okay, and I think I'm done, and we'll hand it over to the next speaker. Oh, to PRR.
Yeah, so this is before we take so the idea is that we're going to have time for clarifying questions now, and then we'll take a break, and then we'll move into the discussion portion where we're sort of weighing the pros and cons of these approaches. So yeah, Rick, I see your hand up.
Yeah, I don't. There's an unintended consequence in here in this approach, and I'm not sure how to square it, but from my reading of how these priorities are getting set up, it largely excludes Latino programs and supporting them because they statistically have lower rates of opioid use and overdoses, and that's exactly at the time when these programs are under most pressure. So I want us to grapple with that problem. So I don't know how you square it, but that would be an unintended consequence.
Rick, what approach are you referring to when you're worried about this unintended consequence? The population-specific approach or the strategy?
The priority populations, like, okay, we're going to hit the populations, totally legitimate approach about we're going to hit populations with the highest opioid overdose deaths, Native Americans, totally support that. But one of the consequences is, at least according to the data there, and I think there's questions about it, that seems to would largely exclude investing in Latino services. And again, just exactly at the time when they're under the most pressure.
So Lisa just noted in the chat that, well, the board can come up with all kinds of criteria in assessing a need in a population. But Lisa noted that needs assessment isn't just based on overdose death rates, also in gaps in services. So that could be another criteria that the board considers. Fernando, did you have a question?
Rick, were you done? I saw you kind of come off of mute. You good?
No, you can go right ahead.
Okay. Procedural question. Which of these would be fastest for OHA to accomplish?
I can jump in, and Lisa, Michelle, I welcome your input. I think that what would be fastest would probably be either choosing population specific or strategy specific, a single approach, because that would be a single RFGA process. They would have similar timelines in terms of doing the partner engagement to finalize the RFGA components and then releasing the RFGA, but that would be a single RFGA. So that would be the fastest.
Being that one is the fastest and that this is one-time funding and it's $13 million, I would advocate that we go for the fastest process that gets one-time funding out the door. The reason I keep hammering on the word one-time funding is because when people first applied for a grant from this money, they were told this was one-time funding. We were asked by the legislature and by the governor's office to not allocate money to programs that were going to need more money to continue to exist. Um, and so the one-time funding approach needs to stand, especially because it's $13 million. And then the other question, this is more kind of, I know this is a discussion. I know this was clarifying questions, but really a big concern to me is also like the reason burns have so little resources right now is because the resources available went down, and the approach was to choose to try to equally distribute that money, which created a situation where no one got enough to actually continue to do the work that they were doing. And so I would counsel us to remember $13 million one time. We need to move quickly so that we can actually get to the process of how we're going to allocate the rest of the money after this money. And so that's kind of my commentary. I would advocate that we pick probably the population specific and then set funding floors, like make it really clear to everyone, because giving everyone $25,000, that's not even one half of an FTE of a peer for a year. So if we want to get bang for our buck, we're going to have to just pick and choose um, using the RFGA process.
Thanks, Fernando. Sheriff Phillips, do you have a question?
Yeah, I just wanted to learn more about what Fernando was saying about one-time funding. Was that always the goal or direction set for this board? I guess
Yeah, my understanding, and please, anyone else who's been with us, Annalise, I'm sure the board members could speak, but because we knew that the money was going to be front loaded, we were basically asked, and this was the right ask and the right approach, to not give money to start up any projects that weren't going to be able to sustain themselves going forward, because it was going to be big drop-offs in how much money we would have to allocate. So it was really important that people were like, give us this money to get going and we'll keep going without the money. And again, that was a direct request also from the legislature and from the governor's office to not do that. So that was always sort of a big part of what we were doing.
To that point, well, okay, so I guess that's the stated goal, and I can respect that. Have things changed where maybe the strategy should be a little bit different? I guess my concern, and I see the value in like, okay, we have a crisis, let's start bringing buckets of water out there to douse the flames, right? And so that's the one-time funding. Let's get as many people treatment in the moment as possible. But have things changed enough that maybe we should look at strategies that would be durable and long-lasting and builds us a road to where we hope to get to? And so I know it's a worthy goal to try to backfill lost federal funding, but I feel like that just fills a pothole. It doesn't help build that road and move us down the chessboard, right? It's like playing checkers instead of having strategies that would be durable and long lasting and it would benefit everybody. And so kind of my thought was like, I think the ADPC wanted a prevention center of excellence. If there was a way to build that and fund it, they could develop the best innovative evidence-based approaches and take that to every community, every CBO, every health department, and help the people that are already providing services do it better. And I feel like that might be the right way to do it in the long run.
So, April, I know you have your hand up. I think Sheriff Phillips, that's a lot to consider. Joanne, did you have a question? You had your hand, your hand
I do. I
up.
do. I can't figure out on my Zoom how to raise my hand. So if you send me a little note and tell me how to do that, that'd be great. Sorry, April, for stepping in. I would be a little remiss if I did not ask the board to consider some of the communities that I represent, and that is those cities that are 10,000 and between 10 and 20,000. I can give a really good example. And while I appreciate Fernando's not only his comments but his expertise, I get concerned about the specific population strategy because we have many communities that do not have adequate um, services available within their community. And the best thing we can do for citizens within those groups is the warm handoff. And in order to do that, sometimes, as our treatment folks can verify, it has to often be when that community member is ready to be served. And so that means having our community agencies, which in those small communities are small, to be able to provide transportation, support, handoff, communication with those communities that have treatment facilities or recovery facilities. And so I think there's a great need there. And I think that the strategy specific approach would probably work well in those smaller communities. And I would hate to preclude them from being able to be considered for some of these grants that would allow community organizations to work together to stand up services and to look at how maybe city governments could fund ongoing resources. So thanks.
Thanks, Joanne. I'm just noting that we are pivoting from clarifying questions to discussion, which is fine, of course. And I think, we're just about due for a break. So I think, April, let's have you talk, and then Fernando, you look like you might have something maybe in response to what either Matt or Joanne shared. And then I think we take our little break and then come back for a more robust discussion. April?
Thanks, Jenny. Yeah, I wanted to respond to a couple things, and it definitely sounds like we're jumping into discussion here, which is good because it's like, all right, we're ready to get going on it. But I think just response to where Sheriff Phillips was asking about the strategy in terms of one-time versus ongoing investments. I just wanted to ground us a little bit in the logistics of the source of the funding and just thinking about the different SUDS funding we have available across the state and how this oh, can you hear me okay? Sorry, is that losing volume? Uh-oh. I don't know what to do.
It looks like you're adjusting.
Okay, maybe I'll just lean in. Is that better? Okay, leaning in. All right. We'll Sheryl Sandberg it. Okay. The one-time versus ongoing investments. I mean, the funding available is by nature one time in that it's settlements awarded out of lawsuits, right? So we don't have an ongoing source to sustain programming after this. And so I think the cliff that Fernando was talking about was the concern the board had and that we had with standing projects up without identifying ongoing services means those projects come back with their hands out saying, how do we keep this going? And we don't have a sustainable source identified on the other side. So that is a real concern. However, to your point about have things changed, I think, what we looked at in terms of what it looks like for these payments to come in, now we see that there is some set of anticipated funding coming in over the next 10 to 13 years, which feels a little bit less than like one time and a little bit more like more sustainable. I won't say sustainable, but like a little bit longer term. And so I think that is something for the board to consider. And I think when we talked about this last time as to what we're trying to make decisions about now, in my mind, and I'll just like to, if this is helpful for other people, I like to separate those things out. So we have like about $13 million that we can anticipate safely going on for the next 10 years or so. And that is very different. And it's the same number, but then $13 million available to us now to talk about allocating as one-time dollars while we plan for that longer term investment. And so we're thinking about this, like this bucket that we have in front of us and what strategies make sense without thinking about whether they are in the long-term category or not, just sort of what's the best use of one-time funding that we have available for this biennium. And I think, the question you're asking around what infrastructural pieces can we make, I've heard you ask this before, Sheriff, and I appreciate these questions because I think it's really smart to be thinking about what investments we can make upfront that could have long-term effects that don't necessarily require ongoing service investment, right? Like not creating more treatment programs where there's a cliff of the funding, but creating like the policy or data collection process that could sustain itself over time. That's a really interesting question. And I think that's what part of the legislative direction was in setting up data and evaluation strategy for out of this funding. And I think where I keep asking, what other states are doing. I think I'm looking for those innovative approaches that other states are using for leveraging this one-time funding for those kinds of strategies as well. So I think what I'm hearing also from the conversation, Joanne, you were bringing up around limited resources in other areas. There's a strong interest in supporting some of the other infrastructure that we have ongoing, or that is ongoing, and filling the gap to be able to support that in the short term, even if it's just short term. So I think there's a lot that between, whether we think about this as a population or a strategy, I think we can talk about what the best use of the funding is for this allocation and try to identify what maybe we would want to support for a longer term. And then also holding both the opportunity for people to bring those projects forward. Like I think it's absolutely possible to, if we had designed the RFGA broad enough that applicants can say, this is what we need in our community. This is how it's going to serve our highest needs population, and this is the best use of this one-time investment. That may, then we don't have to necessarily arbitrarily create too many categories that limit what people present, so that, like to Joanne's point, we can say, in my community, this is what we need, and it'll serve these populations, and we can have the data, the prioritized criteria to sort of assess those applications for alignment with what we can see at the state level of like, yes, this lines up with where we know there are gaps, and be a little less prescriptive about it. That was not a quick comment. I'm sorry, Jenny. You were trying to get me to wrap up this for a break, but it was helpful for me to like, this is the framing that I'm bringing, and I don't know if it's helpful for others, but.
Yeah, no, thank you for sharing that. We'll give Courtney the last word.
Hey, what about me? Oh, my hand came down. Sorry, I just wanted to, because I was
Oh, that's
mentioning the
right.
Common
You're
Core,
right, Fernanda. Sorry.
I just want to be clear. I'm not advocating for any one of these three strategies. What I'm actually advocating for is quick and what April just said. I think I was responding to the three strategies because those were presented to us. But what I actually think is exactly what April said. We designed a broad RFP and a scoring rubric where we then make it open and people can apply. And we have to make it really clear. One time, I don't think we should invest in capital. That will eat up too much money and it will require probably ongoing funding as well. But I think we should make it broad, tell everyone it's one-time funding, and we are not going to give everyone like $10,000. We're going to give X amount of organizations a meaningful amount of money to have an impact in their community. Instead of having to then take whatever. If we give somebody $100,000, not enough money to really do much other than hire maybe one staff member. Is that the best value for that dollar? Probably not. but giving an organization a substantial, few organizations targeted more money is probably better. I'm not at fast. Then we design a longer term strategy in alignment with the Alcohol and Drug Policy Commission comprehensive plan. That has to be the core of any decision that we're making as far as I'm concerned. Because if not, we just continue this random siloed funding of things that, we're literally in a meeting right now where we have a strategic plan created by and authorized to be in use, and also looking at like, well, there's the way the Burns did it, and that's the whole problem. We have to stop doing that.
Thanks, Fernando. Lots of head nods and thumbs up there. Courtney?
Thanks, Jenny. And I'll just say that April touched on a lot of what I was going to mention too, is that when we were coming to present these different approaches to you all today, right? Like, I think what we're just trying to mostly get out of the meeting, just kind of going back to the two pieces that Lisa said early on, is that what is the overall approach and what is the funding amount? And even if there is decision on population specific approach versus strategy specific approach, there's ways that we can design the RFGA that if it's a strategy specific approach, we can still prioritize the communities that are most in need of resources, et cetera. And so I just wanted to mention that and say that it doesn't have to be so like either or. There can be like a melding, but what we just need is that general framework. And I also did just want to mention to Fernando's point about the broad RFGA, that is certainly something that we can do, but I just want to note that as you broaden things, you accept additional, we'll be expecting to receive much more applications with a broader approach. That could also potentially impact the timeline. So just wanted, we can do it. Just wanted to note that that may also have timeline implications as well, because we'll probably receive many more applications.
All right. On that note, Carrie, how do you feel about heading to our break?
I think now would be a perfect time to take a break. I think we have a 10-minute break
Yep.
scheduled, so we'll be back in 10 minutes.
All right. So that's about 11:38 or so.
See you
See
soon.
everyone there.
Hello, everyone. My clock says 11:39, so be great if folks are here, if we could get back and get going, especially since we were running a little bit behind our schedule. Looks like we have a good number of folks here. So, really great discussion before the break. I think that we kind of came around to the things that I would have shared about my understanding of where we're at in the process. And I think, just to reiterate it, we have the funding for the current biennium that we want to get out. And I think the other piece that maybe wasn't, I bet was probably stated, but just in a different way, is that, there are a lot of folks, organizations, communities that are doing work that would benefit from these funds. And this is a way for us to get those funds out to a broad group of people that can make good use of them. And when I was reviewing our notes for the current meeting, one of the things that I think it was Debbie Jones said, sorry, I know my audio isn't very good. Small investments can have a large impact. And I've continued to kind of keep that in my mind as we've had these discussions. So I'm just really excited to move on through this process as we move closer to getting some of these funds out. So I think for the starting point, does anybody have any further clarifying questions that we need to address before we move into the discussion? Skylar?
Yeah, thanks, Carrie. I think it'd be helpful just some of these pieces were mentioned as part of the presentation, but if there are any strategies or tools that folks have come across, maybe in research or even just folks here, that would help the RFGA process move faster, that aren't artificially limiting on like who can apply or what kind of project can apply. I've seen some in terms of, scoring like Fernando mentioned, and I think there's a few different tools that folks have used, but I'm wondering if anybody here who might know a little bit more after research has come across anything that would be particularly helpful in that respect.
Annalise?
Skylar, I'm glad you brought that up. Oh, I think I froze there. Skylar, I'm glad you brought that up. So one thing I will throw out that is a little bit more procedural, but I have mentioned to the OHA staff, and I wonder if folks would be interested in, on the burn side, which is, one of our largest state grant programs. So as they've handled considerable volume. One of the things that they have done is move to submittable, as I'm sure many of you know. And so I have wondered if perhaps we want to use submittable, which for folks who don't know is a grant application platform that is pretty widely known as something that can be, it's up to the state how they customize it, but being low barrier. And given that many of the same folks who are applying for burn grants are going to apply for this, perhaps we want to ensure that our funding for OHA includes submittable.
Hi there. Thanks, Annalise. We definitely heard you about the request for submittable, and we did meet with the burn program, and we've been doing tons of research behind the scenes on the best grants management platforms, and we can bring together some pros and cons, but submittable, it's $150,000 a year, and the burn program hates it. Even though, so there's for a bunch of reasons. And then we have something similar in public health called web grants, also doesn't serve all of our needs. We do have some other options, but we're definitely looking to an eye to make it easy to navigate, and we'll definitely let the board see what we find. So thank you.
Okay, thanks.
And Lisa, that kind of information would be part of that implementation draft plan, correct?
Yeah, I don't know why I said the burn program hates it. It's just that they don't hate it. That's a silly thing to say. But the burn program, it wasn't flexible enough when you're looking at hundreds of applications, and they ended up having to build other workarounds with other platforms to supplement it. It doesn't fill all the needs for a large scale program. That's all.
Thank you, Lisa. Okay. I do want to just briefly summarize what I've been hearing so far from the group, including what we heard before the break. So a lot of interest in moving as quickly as possible, and that gets to Skylar's question as well about process measures that can make it faster. There is an interest in having a meaningful amount of funding per organization, not just small amounts. There is interest in thinking about the impact of whatever process the board takes on the Latino population in particular, interest in impacts to smaller jurisdictions, smaller cities and counties, and items that could support a warm handoff in these smaller communities. Interest in this funding cycle of emphasizing the one-time nature of these grants, and then some interest in a broader RFP with potential funding floors, and then a comprehensive scoring rubric that gets at the board priorities. I just wanted to recap briefly what the two asks are in order to allow the process to continue. I'll just flash that up on the screen real quick so we're all aware. Sorry, I lost my share button. There we go. So we are having this discussion about what RFGA framework or model you all would like OHA to move forward with. And then there also is a question of how much funding you should allocate through the RFGA process. In the discussion before the break, I was hearing a lot of assumption about the 13 million all going into this RFGA process. So I just briefly wanted to bring that point up and see if there's general agreement that you would like to put all 13 million into this RFGA process for this biennium. Does that sound right to folks? Seeing some head nods.
It seems right to me because we have decreasing funding. And so this is the time to try to fill some gaps, not directly, but invest in the services and not just sit on them.
Thank you, Rick. Seeing head nods on that as well. Any other thoughts about the amount or any other opinions? Sheriff Phillips?
I guess mine would be similar to Rick, is that there's going to be a societal expectation that we use these monies to make a difference in our communities. And sitting on them for the future right now probably is not best policy.
Thank you, Sheriff Phillips. Lori?
Thank you. And I apologize since I've been in and out today. I'm at a little bit of a deficit of information, but are we talking about what we currently have on hand, or is whatever we set up going to be inclusive of the new settlement dollars that Adria shared coming in, anticipated coming in?
Tammy, could you clarify that question? Thank you.
Yes, I'm happy to. Thank you. Yeah, the 13 million that we're discussing, it's about $13.5 million, does not include any settlements that are pending and payments that we don't have schedules for yet. So that 13.5 million includes a little over 5 million that's a carry forward from our last biennium in AY25. The funding that we are expecting in AY27, as well as the additional about 3.9 million that 2.9 million, excuse me, that the board last month decided to take from the data systems allocation and bring forward into available funding for distribution and allocation in this biennium.
That's what I thought. Great. So this is basically what we thought we were going to be wrestling with, how to spend this year anyway, minus what we took off for the burns after our retreat, at our retreat. And so yes, then I'm fully supportive because we'll have a chance with some new funds coming in. If the proof of this particular concept doesn't go the way we think, we have another go at it. Thank you.
Thank you, Lori. Any other thoughts on the amount that you would like to allocate to the RFGA process? Are we generally comfortable moving forward with that entire amount? Head nods, thumbs up. Okay, so that answers one of our questions, so that's great. Now, the discussion can get back into the approach. So on the table from the presentation, we heard about strategy-specific approach. We heard about a population-specific approach or some hybrid. And then in the discussion, this idea of a broad RFP, one RFP came up as well. Among those options, which ones are really standing out to folks is something that is worth pursuing with this 13.5 million?
Sorry, Zach, can you repeat the question?
Yes. So among the population-specific approach, the strategy-specific approach, a hybrid of the two, or a broad RFP, which one is really standing out to folks as the best path forward at this point?
Well, like I already said, I think that the broad RFP, I'm certainly sensitive to the fact that that would generate lots of applications to review, but we're in such a funding shortfall, that everyone's going to be applying for everything anyway, regardless of how we construct the RFP. There's going to be a lot of applications to review. So broad RFP. Yeah.
Thank you, Fernando. John?
Thanks, Zach. Just a couple thoughts. Everybody does great comments. A couple of my thoughts. As Courtney mentioned, I think, streamlining with one type of model would probably be, just by its nature, quicker. I would also say that there's so many great considerations. I tend to angle towards what Fernando mentioned in terms of a population model. But a couple things that I wanted to point out that I think might be really interesting and really good talking about Julia's comments and April's comments. April mentioned a structure where there's like tiered amounts. And then, Julia talked about the need for, availability of these funds for communities that didn't get automatically allocated. And something that struck me, and I thought, well, gosh, that type of a framework might seem like a way to meet that need. And it also, to Fernando's point, we're probably going to get kind of inundated, but as opposed to simply, and I don't want to dive too far because I don't know what that will look like. And having been through this before, there's a lot of considerations and legal stuff, as previously mentioned. But in thinking about a review process, that seems like it would make a lot of sense to streamline probably what's going to be a large process anyway, right? In terms of, it would allow both us to classify as the board and whoever's involved in the RFP, the decision-making process, which is obviously us. It would put it into buckets, not our old buckets, and not referring back to the old buckets, but buckets where people could meet their needs for different, well thought out, evidence-based proposals to use these fundings, but not lumping them all together. So I use examples of, a massive project. I don't have a specific thing in mind, but that might be hundreds and hundreds of thousands of dollars, upwards of $1 million, mixed in with a proposal to say, hey, we would like 28,000 for this specific thing. We might have staff ready to implement it and the like, and it would kind of tier them so that we could, hopefully, everybody's never always going to be happy with any process anybody decides, but it would kind of allow us, and I'm not wedded to it, but I just thought it was intriguing when April put that in there and the relation to Julia's comments, and that it might allow for a little better of an organizational structure in terms of the review, but it also might allow for those kind of, I don't want to use the word niche in a sort of a patronizing way, but really specific targeted things that folks want to do that they don't have funding for, but that they could do a lot of good with, but they're not necessarily massive multi-year projects or building or massive infrastructure building, but they're kind of to meet specific needs. I keep coming back in my mind to think that kind of approach might be as good as we could possibly do to meet the varied needs of different folks, whether it's in, CBOs, maybe some academic or hospital involvement, or treatment centers, recovery centers. It would seem to be a little more inclusive in that sense. But anyway, just kind of a couple thoughts that popped to my mind. And I apologize. I think Joanne talked about that because I saw Julia pop up and it was actually Joanne, but my apologies, but thank you.
Thank you, John. Rick?
Yeah, maybe along the lines of where John's been going, but more narrow. I think, I like Fernando's proposal about a fairly wide open process, but I do think we need to do our due diligence work about what are we prioritizing? What are we looking for? And potentially get some real clear ideas about, again, a bunch of $10,000 grants does nothing. There's no impact. You'll never see it again. So, I would want to see something that produces impact, that's meaningful. And, you're really looking at $250,000 and above to really do anything. So I think we need to we can be open, like surprised, but we need some criteria, some ideas about here are our priorities, but we're open to being surprised. So I think that would be an approach I would support.
Thank you, Rick. Julia?
I like the open approach too. And I love the idea of a tiered system. And I'm just thinking about, other funding programs have this where like maybe we allocate 2 million for sort of up to $100,000 projects, and then we dedicate the rest to 500 to $1 million projects. And that way, we're recognizing that we want to do something bigger, but not eliminating those small things that could potentially be really meaningful. Yeah.
Thank you, Julia. Sheriff Phillips?
My thoughts are that we're leaders, and one of the challenges with being a leader is making decisions and coming to the realization that we can't make everyone happy, but that ultimately our decisions should be something that I think people can, in hindsight, respect and understand, hopefully see wisdom in. And so I would propose that we identify goals, like we would like someone from each county to propose a way to increase prevention. And then maybe we have solicit projects from the 5 counties with the highest overdose rate per capita to propose a project to increase treatment in their communities. I think having it too wide open is going to create so many applications that it'd be really hard to sift through. And I think it would be fair and wise for us to identify our priorities and have people send us applications specific to those priorities.
Thank you, Sheriff Phillips. So we have some folks that are interested in that broader process and then are concerned about if we need to narrow that down to make effective decisions. Annalise?
Thanks. I want to uplift a couple things I've heard and then throw something out in terms of aligning with the ADPC. I want to lift up both Fernando's point and Julia's point. I think that would be a really good idea to set aside $2 million for mini grants and for OHA to consider all possibilities for those for very low barrier options, particularly for communities that may not want to be taking money directly from the state right now. And then Rick's point, perhaps a minimum then for the remaining tranche of 250,000. I would also recommend not investing in capital because that will eat up the amount very quickly. $250 million doesn't go very far in capital, and we know that that is a very lengthy process. And considering changes to Medicaid right now and other state funding, I'd be really concerned about standing up more services that we don't know if we can continue to fund. So just wanted to lift those things up. A couple things about the ADPC plan. There are not things in it that are maybe not funded or funded because it was specifically designed to be about spending the money that we have more wisely. So our recommendation for the settlement board funding is that it is spent on things that cannot otherwise be funded, in particular in the areas of prevention, recovery, and harm reduction, or as we call it, health and safety interventions. One thing I will throw out there in terms of reviewing the applications that we've been working through some things with some other funding streams on, perhaps having in the review process part of the review. This would be part of the application. You need to explain how what you're putting forward aligns with the ADPC plan for the state, which is a recovery-oriented system of care model. And we've been toying around with the idea of having, say, it's 10 points that would come to the ADPC. Our staff would evaluate it and say, this is how it aligns, or this is how it can align. That would be part of the points. So I will just throw that out there. The other thing I would suggest is having applicants explain, and this is how I think we can bring in prioritized populations and gaps, having them explain what is the gap they're filling in their community, and what exactly is the population that they're addressing, and why should that be a prioritized population. And letting us know what the continuum of care is. And I know that sometimes people are in more than one continuum of care. So maybe if they feel like they're doing prevention and recovery at the same time, so they can explain both of those, that will enable us to have subject matter experts reviewing those applications, to be able to identify, is this something that is, an evidence-based primary prevention practice? Is this an emerging best recovery practice? So that we have those assurances that it's going to things that we know that we need in the system, and that we'll get the outcomes that we're looking to get.
Thank you, Annalise. Just want to recap to make sure I got all that. So thinking 2 million for mini grants, pretty broad open application pool there. Set a minimum for the remaining tranche of money. Do not invest, no capital investments through this process. And then when people apply, making sure the applicants explain what gap they're filling in the community and where their proposal sits at on the continuum of care, so that when SMEs do their review, they can accurately review that. Does that sound correct?
It does. And just to reiterate, most of that I'm lifting up from other folks, but thank you for, and then the last piece is just alignment with the ADPC plan.
Yes. Thank you. Lori?
Thank you. A couple of things, the comment about a lot of $10,000 grants won't go far. I do want us to keep our minds open to smaller funds, particularly if it's last mile funding. There's a lot of organizations that have been really piecing things together and might just need that last little bit to put them over the top. So I'm going to be a big proponent of keeping some money available for smaller. I think a lot about, I can't remember if I mentioned to this group before, when we had the influx of ARPA dollars at the county, we set aside, our board made a decision we set aside $3 million for a community grants program. This is just Lane County, not statewide, but we received 71 applications requesting a total of just shy of $16 million worth of projects. And I was one of the two commissioners tasked with helping a team of folks cull through and make the awards. And we awarded, now I can't remember how many applications, a lot. I mean, I think we awarded close to 20 applications. And they range from $25,000 to $450,000 awards. And some were very much systems, sort of transformational systemic, and some were small dollar operating grants for like a food pantry. So I see this as a similar thing. And I just see the value of staying flexible and letting the community tell us. I think from a process perspective, for me, what's going to be really important is, I think this is what we're getting at. We don't want to waste potential applicants' time. We don't want to make it so broad that people can't tell. And so they're going to try because everybody's so desperate for money, or they're going to sort of chase the money and create a reason to say they qualify. So I get there's some tension there. I do think, we've talked before about focusing on primary prevention and giving people maximum flexibility, and discretion is often what's the least available. It's the hardest to make the case for. So I support that. And then I think whatever platform or process we use, something where we put out a realistic timeline about what it's going to take to review these applications, so people don't apply into a black hole and not here for 8 months and don't feel ignored. And also that there's whatever platform we use has an easy way for people to log in and see the status update of where we are in the process for full transparency. Are we still reviewing applications? Have we winnowed it down? Are we vetting, and so on? So just when I think of as an applicant perspective, as much transparency and clarity about the process regardless of whether it's by population or strategy, is also going to be really important. People are just so stressed about finding resources that we don't want to add to that with a really opaque process. I think we might be surprised by what we get. So I'd hate for us to put too many limitations on ourselves, and wait and see what folks think they could do with the dollars. And then knowing that we'll have some more funds coming in as we heard earlier, there might be an opportunity to go back to some of these folks if it's still timely and fund them after all when we get more money in. Thanks.
Thank you, Lori, and thanks for sharing that experience with past processes. So definitely heard about the importance of last mile funding, recognizing that small dollar amounts can have a large impact, and then the importance of having sort of clear priorities and rubric up front so that folks know when they're applying what the board is looking to fund. John?
Just again, a couple more reflections or comments based on Chair Phillips and Annalise and Lori's comments, and again what April just put in the chat. So the way I was just thinking about this when Sheriff Phillips made a great point, it's obviously very valid. You're not going to make everybody happy, and that's the process of an RF. It's part of the nature of that process. So I think that goes with the territory. But I again like the idea when we talk about priorities. April made a note of it. I think April, we're on the same sort of wavelength on this. The one great thing, and I think how you could structure it, and all good solid grant structures are really like this. When we look historically at long-term SAMHSA grants and the like, the first bar that you have to meet is that you have to lay out, and Annalise kind of touched on this, exactly on a high level, exactly how your project addresses the core reason for putting it out. And I think the great thing about it is you could do that very well in perfect, and this goes to your statement, April, this would be very consistent with the I'd call it values, but also concretely, tangibly goals that we've set. What's the goal of these funding? It's to increase the viability, I'll call it, not just infrastructure, of the continuum in general, not just continuum of care, in the areas of harm reduction, treatment, prevention, and recovery. Regarding opioids and on the broader case, SUD, as noted before. So I think you can really set this up, and we don't want to be exclusionary, but at the same time, I think it's very easily very defensible, for lack of a better word, and very realistic and pragmatic to say, here's your bar. How exactly be high level but detailed enough at the initial part of the application where you could tell this board, if this board could look at your project, and it doesn't matter if it's funded or not, it doesn't matter if the final decision is to fund it, but when you get to the point where we're debating whether or not to fund X, Y, or Z, or A, B, or C, we know that what we're looking at 100% touches on the areas of concern or goals, whatever you want to call it, priorities, a better way to put it. And so I think that's a really great way to kind of weed things out. Again, not to be exclusionary, but I think when you do that, but you also can tier it, you can do both things at once, right? You can satisfy that, but you can also kind of clearly, as Rick says there, clearly define. You need to show this board how you're doing these things in alignment with our structure, our values, our priorities, and then you can go down, where does your project fit into these different funding tiers about what you need, what you're looking for, and then we get on to what your outcomes are and the like. So
Thank you, John. Joanne and then Nick.
I'm going to just be a little bit more pragmatic than one of the things I think that's important is back to Fernando's points that this is one-time funding. I think we need to be sure that applicants can identify how they are going to maintain the services projected after this funding ends. So it's not so much startup unless they're able to identify how they can continue the services after the grant funding is done. The other point that I guess I wanted to make is that since we're talking about the timeline a little bit, it takes time to review the grants, award the grants, and then for organizations to set up the activities within the grant project. And I think we need to think about whether we are going to require that these or that the grants identify projects that can be completed within the biennium, so that we're not doing carryover of projects that simply cannot be accomplished during the grant funding cycle. So those are my 2 comments.
Thank you, Joanne. Nick?
Thank you. Sorry, when you have your hand up late, folks share a lot of what you wanted to contribute. So I just really wanted to agree with this conversation and where this direction seems to be going. I also really like the idea of something pretty broad, but with the tiered approach. I I want us to make targeted and impactful investments. And I know that sometimes a small investment goes a long, long way. And so that mini grant idea, I'm definitely on board with that. And just want a second or third or fourth, just the comments about transparency. I think both in the process and in the evaluation, just us being really clear about how we came to the decisions that were made related to this investment. There's been a lot of large RFPs hosted by the state in this space, and I think there's been some questions about transparency, and that this board has done a really nice job as far as sticking to our values and our process related to allocation of funds. And I want to just make sure that we're continuing it here. So letting applicants know what our priorities are, how we're going to evaluate in every step of the process. I think it is, if we can do that, knowing that not everybody's going to be happy, at least we can feel confident with our decisions and be transparent about it, and that the public and community is going to feel good about it too.
Thank you, Nick. Yeah, definitely. I'm also hearing that the value of transparency in this process is hugely important to all of you. Skylar?
Yeah, just don't want to have echo anything anybody said. Agree with a lot of what's been said. I think one piece that I might have missed or haven't heard that I just wanted to speak up about is it is important to me to make sure we know like how many folks are anticipated to be served with any grant. I think maybe for the larger tranche and not those mini grants, maybe that's a little different depending on what community you're in, what's possible, which I think should be a consideration. But I'll just say from a kind of large cities perspective, I think that's really something that the public really expects of us to do with these dollars and to make efficient use of those resources. That's not everything, but I think it should be one of the factors. And I think it matters. I think there's been some grants allocated in the last few years, frankly, where I've seen personally, serving 3 people with quite a bit of money. And so I think even if it gets too narrow, that tends to happen. I think we're all talking about having broad categories, but I also just want to mention efficiency and kind of serving as many people as possible. So thanks.
Thanks, Skylar. So having expected number of people served as part of that eval process. Rick?
I just want to draw attention back to what April wrote in the chat. I think that's just a really great basic system that we should adopt. And again, we're not creating anything new out of this discussion. Here's Exhibit E. Here's the strategies from ADPC. And this is the weighted scoring that we will take with that. So April, you're brilliant. Great going. So I fully support that.
Thank you, Rick. Julia?
Yeah, I just want to follow up on some comments that Sheriff Phillips said, and I like the idea of, we're kind of like talking about different things that are almost like evaluation criteria, but I like the idea of a goal of trying to have that geographical equity around the state. I don't know if it's realistic to say we're going to get one, ask for one application per county, because then they have to compete about who actually is going to be submitting that. But I like the idea of, in addition to how many people are served and what gaps you're filling, trying to make sure that we're reaching all parts of the state. I don't know that there'll be enough money to allocate one grant per county anyways, but I think just trying to be cognizant of that as we're also trying to figure out how we allocate the funds.
Thank you, Julia. Okay, I just want to summarize what I'm hearing so far. I think it sounds like there's general consensus about moving forward with one RFGA that has some tiers in it, some smaller amounts and then larger amounts, and then making sure that the OSPTR board values and Exhibit E are clearly reflected in that scoring criteria and rubric, and that there's transparency up front about what we're awarding, so that folks can make an informed decision about if they're applying for the grants or not. Also heard the importance of geographic equity being raised as well. I wanted to give OHA staff a chance to respond to anything that they've heard. Is there additional detail that would be helpful based on what you've heard so far? Courtney?
Yeah, thanks, Zach. And thanks to the board for this discussion. This is really, really helpful and providing us good direction. I think that the one thing that would be helpful for us in terms of decisions moving forward is, I guess, maybe being really clear about how prescriptive OHA's process is in selecting grantees and applications to be funded, just because that just really demonstrates how important like very like concrete evaluation criteria is. And I think that the biggest sort of risk that I'm seeing in this right now is that without an award ceiling, we do have the potential, if there is an application that we receive that's requesting $5 million, for example, and that is the top scoring application, like because of the processes that we follow, that would be selected first from funding and kind of limiting it down. And so I think that having at least like a range within the tiers would be helpful for us moving forward as we think ahead to defining that evaluation criteria. I welcome other OHA, and Stephanie, I know that you're still on here too. If you have additional things that you want to share about the evaluation and scoring process, and if there's other details that we need at this point from the board.
Thank you. Yes, Courtney, I'm just kind of taking it all in. While at the same time, I do think that the prioritization is a good concept, and then seeing what's kind of left over, I guess. I don't know if that's a good word to use, but what's remaining after that prioritization to see if there's what other innovation that other people are using that we didn't think about in our priorities. Yeah, like I said, I'm just trying to take it all in and just brainstorm while this is all ongoing. But thank you.
Yeah. Of course. And then just another comment that I wanted to make too in terms is we're talking about all of the different priorities. And what I've been hearing is, how does this align with the ADPC? What populations are you serving? How big is that population? Just want to call out that the more of like those types of categories, the more questions folks are going to be answering as part of their application. And that makes it we were saying low barrier applications, right? And so it's sort of moving away from lower barrier applications as we're talking about additional questions that grantees will be responding to. And so just, again, it's fine, but just wanted to flag that consideration as well.
Thank you, Courtney. I know, Lisa, you have a comment?
I saw that Fernando and Joanne have their hands up and want to make sure I'm not cutting the line. Oh, I think you're on mute, Zach.
I was going to say, Lisa, go ahead.
Yeah, do you have stuff to
Oh,
add on to
okay.
what Courtney was
Yeah.
saying? I think
Oh,
that makes
okay.
sense.
Thank you. Yes, thank you, Courtney, for those considerations. And I also, as we start drafting this implementation plan, it will include sections on how will we engage partners, how will we engage the board. And I would love if there's time to hear a little bit of input from the board on how you would like to be engaged. Obviously, when we start forming review teams, board members are absolutely welcome to serve on review teams, but I'd love to hear like at what level the board sees itself as being involved to make sure we're capturing your wishes.
Thank you, Lisa. Fernando?
Yeah, actually, what I was going to ask is kind of right in line with what Lisa's asking and trying to help OHA staff kind of get to where they need to get. I feel like given that we've got maybe 30 minutes left before we have to go to public comment, we're probably not going to get all these things answered today. And I was wondering, would it be possible for Lisa and Courtney, your guys' team, to kind of create a list of questions of like what parameters you need to have answered to be able to move things forward and then send that out to board members to your comment about engagement rather than waiting for another month where you guys are all kind of working sort of on sort of hazy direction. Maybe if we slow down the process a little bit, get some clarity around the parameters, maybe a doodle poll around like the scoring rubric, around what people, like culture specific services, like, and people can like score what they think. Um, and then maybe kind of start moving it that way. I don't know if that would be helpful. And then the other thing I had was like, I haven't heard anything from any of our partners with DOJ. So I'm assuming that everything we're discussing so far is okay.
Adria, did you have a response to that last comment? Don't want to put you on the spot.
Yeah, that would be Shannon's purview and not mine. I cannot provide legal advice from my position.
Yeah, I don't have anything to add at this point.
Okay. Thank you, Shannon. Julia?
Just a couple of comments. I like Fernando's suggestion about having a list of questions and allowing us to chime in. I guess I just want to make sure from a process standpoint, I assume that's sort of going to OHA and then they're just taking that all in and deciding if there's conflicts, how they're going to deal with that, because we can't all share that. Otherwise, we're having a meeting outside of the meeting. I was just initially, I kept raising and lowering my hand. My 2 cents on the ceiling, I advocated for like a 500,000 to $1 million range for the larger grants, figuring that could give us between 11 and 22 larger grants, depending on how much people were requesting. So that's my 2 cents. But I do agree with Fernando. We are probably not going to have the time to go through all the different questions that they have and all of us provide our feedback. So.
Thank you, Julia. Before I get to Joanna, I do just want to note, Jenny posted this in the chat, but we do not have any public comment signups. So if folks would like to continue this discussion for a little bit longer, we have the time to do so. Joanne?
I just wanted to comment a little bit on the service numbers versus need. It would be unfortunate if we had some of the smaller grants that were having to compete against large organizations that might have large numbers of service and ignore that we have some communities and maybe some of the smaller grants that are really have a greater need. So I wonder if we could talk more about that as we go through, as Fernando suggested, some of the criteria, but that we would be able to respond to. If we could talk about that question a little bit more too, because I would hate to see some organizations that have a really significant need, but both based on population and based on location or region, but would not be able to compete with organizations that are serving larger numbers.
Thank you for raising that, Joanne. So based on Fernando's comment and the agreement that I'm hearing, it sounds like a potential next step for this group would be for OHA to send some sort of form or survey that basically checks the assumptions of what they heard in this meeting and make sure that we captured everything correctly. And then OHA uses the results of that survey to start working on a draft implementation plan based on those results, and then potentially flag any areas that there was lack of agreement in the survey results or any tension that we can then discuss in person at the June meeting. Does that seem like a workable next step, both for board members and OHA? Okay. Seeing lots of head nods and thumbs up. Okay. Great. And then in that case, yeah, we're not going to have a motion today. But if there are any answers to Lisa's, or initial answers to Lisa's question about how you see the board being involved in the selection process or outreach process, we do have a little bit of time if you have thoughts on that. Sheriff Phillips? Oh, sorry, you're on mute.
I thought I figured this out by now. Did I hear you say in person at the June meeting?
Yeah, basically, if there was areas as the draft implementation plan was being worked on where there wasn't clarity from the board, or maybe there were mixed results in the survey, just making sure that we highlight those virtually.
Oh,
Sorry,
okay.
in person, virtually. I realize what the problem is now. Thank you.
Okay. I was going to say, I would love if we could meet in person again and actually tackle issues as opposed to what happened to our last in-person meeting. Uh, the I feel like what you can accomplish in a 3-hour virtual meeting is very different than what you can accomplish sitting at a table with each other in 3 hours. And I think there's a lot more feedback and discussions that could have been had around a room of people or even some breakout sessions than what we can accomplish online. And this is so important to me. I'd happily travel to have these discussions. I know it's not easy for everybody, and some have to come from farther away. But I also see a case maybe for some committee work to find solutions on to how we're going to allocate the money that we have available to address both or all three: prevention, treatment, and recovery, and to more define what our goals are with this money for this biennium.
Thank you, Sheriff Phillips. Yeah, we can definitely discuss potential for in-person stuff moving forward. Any other initial thoughts or comments on how the board would like to be involved in selection or outreach process for this RFGA? Sheriff Phillips?
Yeah, I'm sorry. I just feel like it's hard for us to guess how we want to be involved until we know what we're going to be asking these organizations to submit on.
Okay, seeing some thumbs up on that. Definitely can be something that we discuss at our virtual June meeting. Skylar?
Yeah, I would just say I think one thing that would be really helpful for those of us who've already had outreach from organizations is just something very easy to send folks. I think you would all put that together, whether it's a web page or a link. But I think as long as that feels really clear to folks and we can send that out broadly, that would be my request.
Thank you, Skylar. Courtney?
Yeah. Thanks, Zach. This is just in response to Sheriff Phillips' last comment. So the ways that I'm seeing opportunities for involvement in this from board members is either potential like ad hoc planning, right? Like what we're going to be doing is kind of taking back what we've heard from you all today. We'll be doing this follow-up survey and then putting together it's an implementation plan, but it's more of a roadmap really of how we will continue to develop the RFGA. And so within that timeline of additional partner engagement, there could be opportunities for board engagement as well. So meeting with an ad hoc committee of the board or continuing to have conversations with the board monthly and coming back to sharing with you all what we have heard from our partner engagement and continuing to refine the components of the RFGA. And so I just kind of wanted to throw that out there. And then obviously too, once we start receiving applications, that's an opportunity for the board to participate if you actually want to be reviewing applications. And so just wanted to throw that out there as potential options for engagement and involvement in this process from board members.
Thank you, Courtney. All right. We do have a little bit of time left and still no public comment sign-offs. So just wanted to open the floor for any other comments, reflections on the meeting today, anything that you haven't shared that you would like to with the group. Fernando?
Just in the spirit of kind of processing some of the information I process verbally. You guys have heard me say this. It would be, I think it'd be cool if we had something in the evaluation that says how is this aligning with the state strategic plan, with the ADPC strategic plan, and also creating because innovation is key and is important, that we can also make a question around, is this an innovative strategy that can also be considered? Because we don't want to limit innovation. Like to Annalise's point, the state plan, the strategic plan is about how to spend the money better, not what specifically to spend it on. And so I think that requiring, beginning to move the system gently, slowly to the idea that like grant dollars will have to somehow in some way start aligning with the strategic plan. So yeah, that's just, I'm repeating myself, but that's, I wanted to make sure to get.
Thank you, Fernando. Annalise?
That was actually a great, oh, sorry, my connection keeps lagging, but if I can say this really quickly, I thought about giving this during public comment. The commission is actually meeting on Monday, and one of the topics of conversation is developing specific metrics for these different lines of funding. You know, the ADPC has to, in our comprehensive plan, we're responsible for making program level and funding particular recommendations, but because we haven't had information in the past from the state agencies on how they're spending their money and what their programs look like, we haven't been able to make those yet. So this is not the only funding stream that's kind of saying, hey, we need your metrics now. So just so folks know, that is a topic of conversation at the Alcohol and Drug Policy Commission on Monday, rooting ourselves in the recovery-oriented system of care framework. So that is something for the board to always go back to. And I'll just give a very quick example of some work in the comprehensive plan that is happening right now, an update from Sunday. So the comprehensive plan as part of the recovery strategies is to develop a definition for recovery community centers. You'll remember that you invested in recovery community centers, but we don't actually define those anywhere in statute or rule in Oregon. So the recovery committee has been working to do that. They had a summit on Sunday, the day before the Pure Apocalypse conference, which is a huge conference down in Seaside, where we brought together the directors from all the recovery centers across the state to talk through not just what the definition should be, but what the common data collected and the common metrics for success should be across the recovery community centers. So that's something we're working to finalize and bring back to you all, so that if you invest in that, so not micromanaging how you spend your funding, but if you do invest, we want you to invest in it in a way that we know that we are more likely to get those longer term outcomes that we are looking for, and to start to have uniform data collection across all state agencies, which is a huge lift, but we'll get there eventually. So that's just a quick update.
Thank you, Annalise. Sheriff Phillips?
Yeah, I just wanted to mention one of the first things Fernando talked about today was essentially that time is of the essence. And I feel like we had great conversations today, but didn't necessarily make a lot of progress towards how we're going to allocate the funding and what our priorities are going to be. And so maybe we can do, each of us can do some homework, or maybe your team, Zach, can help solicit some feedback from the members of the board on where we think our priorities should be for each prevention, treatment, and recovery, and kind of some ideas what that looks like. And maybe you can compile that feedback and find areas of overlap to start driving the conversation towards specifically what we're looking for in these applications. I just feel like, it feels like we're a year out, but man, it takes time to get this out there, to do the solicitations, to evaluate them, and then to get the money out there. So I feel like we need to be thoughtful that time is ticking by, and meeting month at a time is not going to be fast enough to be responsive to the needs.
Thank you, Sheriff Phillips, and that's a great setup. I was going to say we're going to send that survey, so all of your participation will be really helpful in that, so that we can find those overlaps and identify what this process is going to look like ahead of the next meeting. So we'll work to get that out quickly and then send reminders. But if you can all be on the lookout for that and take it once you get it, that'd be very helpful. But yeah, I agree. We had a lot of discussion today, a lot of good discussion, and now it's time to sort of focus it in so that we're set up for the next meeting. April?
This is a more, oh, am I there? Can you hear me?
We can.
Okay, great. This is more of a somewhat personal note, but I just wanted to let folks know that I am going on parental leave again, which for folks who've been here before, I had a baby a year and a half ago, and now my partner is expecting our second baby, and we will have a second baby here before the end of the month, so soon. Thank you. So I will be gone for 8 weeks, so I'm going to miss the June and probably the July meeting as well. But I will do my best to connect with my director, who will be stepping in for me, and OHA staff to sort of, we had some really great conversations ahead of this board meeting, and really appreciate your time checking in to help wrap our heads around this. And then, and of course, we meet with the other state agency folks too. So I feel like we'll be well represented, and I just really appreciate the support and energy and heart that you all put into this work. And I will be back for the August meeting to see what all happens, which is like doing all the party planning and then missing all the fun, but oh well.
Thank you, April, and congratulations. That's so exciting.
I was going to give you a thumbs up or a heart, but I'm not, because you're not going to be here and we need you here. I'm just kidding. Congratulations.
All right. Any final thoughts for the group before we adjourn a little bit early today? All right. Seeing and hearing none. Carrie, would you like to close us out?
Sure. I love leaving on the note that April's welcoming a new member into their family. Just wishing you well as you adjust. And I just always love our work together. I was also feeling some anxiety about the timeline. I feel like we know that there is a great need for these funds in our communities, and we know that there are organizations and folks that will put it to really good use in changing the lives of Oregonians. And I actually went back and looked at the tentative timeline slide, because I was like, what is we were supposed to get to the point of having a vote today and we didn't get there. And I'm like, how is this going to impact things? And I feel like, thankfully, it feels like there may be some like more flexible time frames written into that timeline, like summer and fall and winter. And so I don't know if that helps other people, but it kind of helped me feel a little bit better about not getting to that outcome that we had sought today. Um, and also just, time is of the essence. And we also want to do a thorough, thoughtful job that, our board has really stayed the course on that, and really wanting to not rush into making decisions and really being thoughtful and strategic. And I think that we continue to show up and act in that way. And so I just am like, again, I can't say enough how grateful I am to be in this with you all and doing this work with you. And I'm really excited to continue taking one step forward and putting one foot in front of the other, and we will get there. And I think this next phase is going to be really exciting. So just look forward to continuing it with you all. And um, we'll look forward to seeing you virtually in person in June. So I think that's it. I think we can adjourn.
Yeah, and just to clarify, Carrie, I think we can still get to a draft implementation plan for the board to review in June. So I think we're still we're right on time. So
Wonderful.
thanks to this good conversation. Thank you, everyone.
Very good. Thanks so
Thank
much.
you.
See y'all soon.